We all know more or less about sinusitis. Precisely 34.8% of children aged 1 years had maxillary sinusitis, followed by 27.3% of those aged less than 1 year. On the other hand, 41.2% of children aged 10 years had frontal sinusitis, followed by 29.4% of those aged 5 to 9 years. Sinusitis is an inflammation or swelling of the tissue lining the sinuses. The sinuses are 4 paired cavities in the head. Narrow channels connect them. The sinuses make thin mucus that drains out of the channels of the nose. This drainage helps keep the nose clean and free of bacteria. Generally filled with air, the sinuses can get blocked and filled with fluid. When that happens, bacteria can grow and cause an infection. This is also called dreinous sinusitis, with rhino meaning nose. The nasal tissue is almost always swollen if sinus tissue is inflamed. What are the different types of sinuses near the nose and eyes? The paranasal sinuses are located in your head near your nose and eyes. They are named after the bones that provide their structure. The ethmoidal sinuses are located between your eyes. The maxillary sinuses are located below your eyes. The sphenoidal sinuses are located behind your eyes. The frontal sinuses are located above your eyes. The giant sinus cavity is the maxillary cavity, and it is one of the cavities that most often become infected. There are different types of sinusitis. Acute bacterial sinusitis. This term refers to a sudden onset of cold symptoms, such as runny nose, stuffy nose, and facial pain that does not go away after 10 days, or symptoms that seem to improve but then return and are worse than the initial symptoms. It responds well to antibiotics and decongestants. Chronic sinusitis. This term refers to a condition defined as nasal congestion, drainage, facial pain or pressure, and decreased sense of smell for at least 12 weeks. Subacute sinusitis is used when the symptoms last 4 to 12 weeks. Recurrent acute sinusitis. This term is used when the symptoms come back 4 or more times in 1 year and last less than 2 weeks. Who gets sinusitis? A sinus infection can happen to anyone. However, people with nasal allergies, nasal polyps, asthma, and abnormal nose structures are all more likely to get sinusitis. Smoking can also increase how often you get a sinus infection. There are an estimated 31 million people in the United States with sinusitis. How can you tell if you have a sinus infection, cold, or nasal allergy? It can be challenging to tell the difference between a cold, allergies, and a sinus infection. The common cold typically builds, peaks, and slowly disappears. It lasts a few days to a week. A cold can transform into a sinus infection. Nasal allergy is inflammation of the nose due to irritating particles. Symptoms of a nasal allergy can include sneezing, itchy nose and eyes, congestion, runny nose, and postnasal drip. Sinusitis and allergy symptoms can happen simultaneously as a common cold. If you are fighting off a cold and develop a sinus infection or nasal allergy symptoms, see your healthcare provider. You will be asked to describe your symptoms and medical history. Sinusitis can be caused by a virus, bacteria, or fungus that swells and blocks the sinuses. A few specific causes include the common cold, nasal and seasonal allergies, including mold allergies, polyps, a deviated septum. The septum is the line of cartilage that divides your nose. A deviated septum means that it isn't straight, so it is closer to the nasal passage on one side of your nose, causing a blockage. A weak immune system from illness or medications. For infants and young children, spending time in daycares, using pacifiers, or drinking bottles while lying down could increase the chances of getting sinusitis. For adults, smoking increases the risk of sinus infections. If you smoke, you should stop. Smoking is harmful to you and the people around you. Is sinusitis contagious? You can't spread bacterial sinusitis, but you can spread viruses that lead to sinusitis. Remember to follow good hand washing practices. Avoid people if you are sick, and sneeze or cough into your elbow if you have to sneeze or cough. What are the signs and symptoms of sinusitis? Common signs and symptoms of sinusitis include postnasal drip, nasal discharge or stuffy nose, facial pressure, headache, and or pain in your teeth or ears, halitosis, cough, tiredness, fever. How is sinusitis diagnosed? Your healthcare provider will ask you a lot of questions to develop a detailed medical history and find out about your symptoms. They will also do a physical examination. During the exam, your care provider will check your ears, nose, and throat for any swelling, draining, or blockage. An endoscope may be used to look inside the nose. You might be referred to an ear, nose, and throat specialist in some cases. If you need an imaging exam, your provider would order a computed tomography scan. Some of the home remedies used to treat sinus infection symptoms may help prevent sinusitis. These include rinsing your nose out with salt water and using medications that your provider might suggest, such as allergy medications or steroid nasal sprays. You should avoid things you are allergic to, like dust, pollen, or smoke, and try to avoid sick people. Wash your hands to reduce your chance of getting a cold or flu. Sinusitis, or swelling of the tissues of the sinus cavities, is a common condition with many causes, including viruses and bacteria, nasal polyps, or allergies. Signs and symptoms may include facial pressure, fever, and tiredness. You can treat symptoms at home by resting, taking over-the-counter products, and increasing your fluid intake. Make sure you contact your healthcare provider if symptoms do not improve, if sinusitis happens often, or if you have any symptom that worries you. Did you suffer from sinusitis? Let us know in the comments below. Stay healthy until our next video come out. Till then, stay with Health Coach.